Hi, everyone. This is Jessica Rial with jessicarealpt.com, and I am super excited today to be here with Shelly Prosko, who is a physiotherapist out of Canada, practicing in Sylvan Lake, Alberta. Did I get that right, Shelly?
Yeah, awesome.
And she has a unique background. So she is a physiotherapist, but also is a practitioner in yoga therapy and specializes in working with chronic pain population, and along with that works with individuals who have pelvic floor dysfunction and pelvic pain. So with our recent conversations on the blog, looking at fitness, looking at movement, particularly for those with pelvic floor dysfunction and pelvic pain, I thought it would be interesting to chat with Shelly a little bit about her practice and what she's doing in working with these individuals. So thank you for joining me today, Shelly.
Yeah, thanks for having me.
So first, I was wondering if you could just share a little bit with our blog followers about your background, what you're doing with your clinical practice, yoga, teaching, and Shelly's also writing a new book.
So I integrate yoga practices, yoga philosophy into my physiotherapy practice. So I work with, as you said, people that live with and suffer from persistent or chronic pain, pelvic floor dysfunctions, and really just anything that us physiotherapists works with. So I help people reduce and manage pain, help people recover movement, recover function, improve quality of life, and then even play a role in people's health, like just overall health and wellness. And I call it like health creation instead of health prevention, health creation. And so I integrate a lot of different yoga practices, not just movement, but breathing and meditation and different philosophies from yoga. And I use that as a framework in the sessions. And I also teach, as you said. So I teach courses. I teach courses to healthcare professionals to learn how to integrate yoga into their profession, particularly physiotherapists or physical therapists, but other professionals as well, and stay within your scope of practice to do that. And then the book, I'm writing a book. I'm co-authoring and co-editing it actually with Neil Pearson and Marlisa Sullivan. And they're also physical therapists and yoga therapists. And the book is Yoga and Science in Pain Care, Treating the Person in Pain. So it'll be a textbook that really outlines the science behind yoga, why and how we think it works, and how we can integrate yoga into our sessions and helping people that are living with pain. And then, of course, we have sections on contemporary pain science. So it's kind of mixing the two worlds, right? The ancient yoga world with the modern healthcare, because they both have so much to offer.
I love that. That's awesome. I myself practice some yoga, and in my clinical practice, I've been particularly interested in working with my patients who do have pain. For me, it's mostly chronic pelvic pain and varieties of chronic pelvic pain, because I find that the integration that yoga has with breathing, with mindfulness, with awareness of the body's position works really, really nicely in a pain population. So that's pretty cool. Now, what about working with people with pelvic floor dysfunction and pelvic pain in general from a movement standpoint? How did you start working with that subgroup?
So actually, Jessica, you cut out on me, so I didn't hear the question. Sorry.
No. So I was just wondering, in terms of your experience working with individuals who have pelvic pain in particular, how did you get started working with that particular population, or did it just kind of happen in your practice?
Yeah, it just kind of happened. It's a long, convoluted story. There's no one thing that happened. I've been asked that question before, and the best way to answer it is early on, around 2001, I was working at an outpatient orthopedic clinic in just outside of Atlanta, Georgia, actually.
Oh, Atlanta.
Yes. And it was in Athens, Georgia. And it was earlier on in my career, and I was integrating yoga into my practice back then. But I was a generalist. I was a muscular in an outpatient orthopedic practice where we see mostly people who suffer from musculoskeletal injuries. But, you know, it was my boss, the manager of the clinic, who just suggested, you know, there's no women's health practitioners here, you know, pelvic health, are you interested in learning more? And I said, yeah. So that's kind of where the pelvic floor health aspect started. And then it just grew from there. It's another sort of long story, but I had some friends in my life that knew that I was doing this work in pelvic health. And they said, hey, and I was doing workshops. So I was doing yoga workshops. And they said, hey, is there anything that, you know, that you can do with, you know, my leaking urine when I jump on the trampoline? And so I said, yeah, of course, that's a big part of what I do to help people. And so one of my friends said, well, how about we get a bunch of us together and we'll come to my house, we'll have, you know, wine, we'll have a fun night and do a little workshop for us. So there was, this is probably 8 years ago. And so there was, you know, 5 or 6 of my friends, and we had a lovely evening, and I put on a little, you know, 3-hour workshop for them on how to integrate yoga and use yoga, to help them with their urinary leakage. And so that was the first time I did a workshop specifically on, you know, how to use yoga, different practices for people with incontinence. And then the yoga part, that's another long story, but basically I started yoga in the early 90s, just practicing. And then I received my physical therapy degree in 1998. And then I just started incorporating yoga into physical therapy. And I've been doing that, you know, for the last it's 20 years now that I've been doing that. And so I've had some formal training in therapeutic yoga, and I've had some informal training in my own practice, and just figuring out on my own how to integrate yoga to help women, men and women, who suffer from pelvic floor issues. Kind of a long-winded answer, but
no, I love it. I love it. That's great. That's great. So for those of you who don't know, who are listening, Shelly also has a pretty incredible blog, I think. And I have loved reading what you have to say on there, and also listening to the videos that you've done. So Shelly has done a series that she calls WOW, Words of Wisdom. And it has been, she's interviewed several really incredible people. I'm going to go ahead and link that below our video here so you guys can check that out. But I'm just curious, with the people that you've chatted with in the past, what were some of your favorite conversations that you had through WOW, for our readers that might be interesting for them to check out?
Oh, wow. Thank you for asking me that, Jessica. Thanks for watching them, first of all.
Yes, they're great. They really are.
I love them. I love doing them. They're just fun and candid, and I'm only doing them in person. That was the deal I made with myself, like not doing it, you know, like via online. Yeah, which is great though, which is great. But I just was like, you know, I'm just gonna, do them when I see people and, you know, my friends and colleagues. So my favorites, there's so many. So some of my favorites for sure, Lorimer Mosley, you know, well, he's just so engaging in that too. We all love him, and, you know, he's just so brilliant and kind. You know, brilliance is one thing. There's a lot of brilliant people out there, but he's so kind and genuine and authentic. So for that one, if you can link that, what I love about it for both healthcare practitioners and, you know, people in pain or that may be suffering, what I love is how he wrote the book, Explain Pain, like that. He's the guy. And that's what us healthcare professionals are trying to do, right? Is just pain education more and more and more. But he says, you know, he's really quite apprehensive about where this explain pain has gone. It's something we do to someone. Yeah. So, you know, he's talking about in this WOW chat about it shouldn't be something we do to someone or just another modality that we plop on top of an outdated pain paradigm or an outdated understanding of pain. So, you know, that's a really good one to look at, like what really is this explain pain all about? And it's more an understanding of the human. And then the second part to that, it's for everyone, how he talks about, he told me to stop hanging around people who always agree with me. And he called me on it, that we had a conversation, you know, the day before that. And it was just, so it's just a really, I love that WOW chat. And then check out Dr. Gabor Mate. So I don't know if you've seen that one. But Dr. Gabor Mate is he's an author. He's a physician. He speaks internationally. He has some great books. When the Body Says No is one of his most popular books. But Dr. Dr. Gabor Mate talks about in this WOW chat, the importance of compassionate inquiry with our patients, and how we can inquire with them compassionately, and how first and foremost we have to take care of ourselves as a healthcare practitioner. We have to be in a good space and clear and not judgmental, and it's just, it was very yogic, even though he's not a yogi per se. It was very yogic in that as a healthcare practitioner working with people, we really need to be, like I said, aware and mindful and present, and pay attention to what's happening inside our body. When we're, noticing our reactions, are we judging, noticing if there's our breath changes or if there's tightening in our body. And anyways, those are two of my favorites. Check out Carolyn Van Dyken's WOW chat. She talks about courage for all of us. She's a phenomenal pelvic health educator, actually, and she talks about being called on. She spoke at this huge pain summit, and someone had tweeted, "Oh, there's Carolyn Van Dyken pathologizing the pelvic floor." And so she talks about that experience and how at first she was defensive, but then she used that to grow and evolve. And the courage of this woman is phenomenal. And Diane Lee, that was a phenomenal WOW chat, talking about, I got up close and personal with her. She talked about her hip injury and, how she feels like she can still be healthy and worthy, just because she, even though she has a physical injury and she is limping, and that she still is connected to her essence of who she truly is. And that was a great one too. So I could go on, but I better stop.
Those all sound absolutely incredible. I know I've listened to a few of those, but haven't listened to all of them. So I'm excited about checking that out myself.
You got me going. Now I want to tell you more on self-care. Staff and Elgely talks about stop chasing, information, just get still, and your wisdom is inside of you. And they're fun. They're just fun.
And it's interesting because in many ways, all of the different ones that you just mentioned are all facets in some ways of how we are now understanding working with individuals with chronic pain. All these different facets with how we communicate. I think communicating with compassion. I'm really excited to listen to that one that you just mentioned, and in thinking about our own self-care as therapists, and how do we care for ourselves when we are working with people often under a pretty heavy burden. I loved that chat that you had with Lorimer, was incredible. And I particularly loved that statement that when he was talking about how some clinicians take the idea of explain pain as an intervention. And it's interesting, in a lot of mentoring that I do, I will sometimes talk with clinicians and they'll make this statement of, well, I already educated them about central sensitization. And then they're like, so what else do I do? And I think it's just completely mistaking this idea that if you really understand the science of pain, then it should not be an intervention, but it rather should be interwoven through everything you do, through every interaction, every word that you say to that patient should be totally influenced by the science that we now understand. So that really is a fantastic chat. But along with that, now that we've gotten going and we're excited about this population, do you have any unique words of wisdom for us? I know this is such a huge question.
Yeah, I have a lot to say, but I think just, thinking of all these WOW chats, and, because I was doing them selfishly because I love asking people questions and I'm so curious, and I wanted to get some information, right, and knowledge, and I want to grow and evolve. And one thing I'm learning from all these people, and just life in general, and from my patients, and from 20 years of being a practitioner, so life lessons and lessons as a clinician and lessons from my patients, is that my words of wisdom would be, we have so much wisdom ourselves, like our own experiences, our own body is just so wise. And yes, we need to gather information and knowledge. That's important, and never stop learning. But at the same time, I think we have to sometimes step back and just trust that we know what we need to know to get through what we need to get through. And if we don't, that what we're going through, whatever struggle it is or whatever joy it is, that's there for us to experience. We have to experience to then evolve and grow to the next step. So just trusting, like, what is inside of us. We have the resources. Yes, we can call upon support, absolutely, and help and guidance from friends, family, healthcare practitioners. But don't underestimate the power that you have, and even your own, up in your own brain, and what works for you and what doesn't. And if something doesn't feel right, you can have all the evidence in the world that says that, well, you're supposed to do this, or listen, get still, listen to your heart, yourself, and wow, is that empowering too. So that's what I would say, is just step back and love yourself and listen to your inner self. And there's so much wisdom and healing that can happen there.
I love that. And, that's pretty incredible. As you were speaking, I was thinking that everything you were saying is true for both the clinician and for the patient. For a clinician to be able to trust their own intuition, and that's such a big factor in trying to figure out how to treat patients, but also for the patient. I remember when I was in PT school, one of my professors said to me, it was just such a small statement, but really has stuck with me. He said, if you truly listen to your patients, they will tell you what is wrong with them. And it's amazing because it's so basic. Of course, we should listen to our patients, but I can't tell you how many times, I know you've had this experience too, that I'm chatting with someone and I ask them, well, what do you think? What's your gut say? And they'll say, this might sound crazy, but this happened 7 years ago, or, I'm feeling this and I think this is connected to that. And it can just be this really, I have like goosebumps for it, because our bodies are so smart, and there can just be this really deep intuitive wisdom that can come across in the body. So I that's beautiful. Thank you. I guess this next few questions, they're kind of interconnected. So we started talking a little bit about pain science and about that being interwoven within treatment. I think when working with individuals with persistent pain, whether it's pelvic pain, but really any type of pain, we see that often when it comes to movement, there can end up being this big fear clouding movement, this fear that as I start doing anything, it's going to make me worse. And so the other option is just to do nothing. And then people can get very frustrated, and unfortunately, they can often see certain healthcare providers that may feed into that fear a little bit and tell them to stop doing this, stop doing that, and not give them replacement options. And so that can be challenging. And I think with your line of work, being a yoga therapist and a physiotherapist, movement is so intertwined in everything that you do. So I guess my two questions are, what are your strategies for helping someone who is in a persistent pain state to start moving towards healthy movement in a way that their body is not going to be guarding and protecting by pain? And then how do you then use your knowledge of pain science within your interventions for movement to help someone move forward with pain?
Okay, great. That's a big question.
I know what you're trying to go.
I could go
You have 4 hours. Go ahead.
It depends, right? Of course, it depends on the person where I'm going to go here with this answer. But strategies, just to kind of maybe generalize it, if I can, first and foremost is creating a safe space. That is key. Right? The person needs to feel safe, so that whatever that looks like, that may look different to different people. So the environment, my relationship, listening, you had mentioned earlier, that's a very important strategy, starting with the listening and giving that person space to be seen, heard, believed. Mm-hmm. And that's absolutely key. If you don't have that, then the person's nervous system may be in this physiological state of defense, right? So you have to start with that. And that can look many different ways. That's with, like I said, listening, talking, and just meeting the person where they're at, maybe doing some motivational interviewing. And getting into the crux, which I think you're really asking, you know, what strategies, you know, I start a lot with awareness practices. So different breath, body awareness practices, even being aware, scans of thoughts, emotions, and then from there, doing that in a place of rest, then you can start to learn how to regulate that. So first, awareness. It always starts with awareness, because you can't regulate or change these things unless you're first aware. So the awareness practices are first, and then next are the regulation practices. So that may be a certain yoga breath practices, right? There's a lot of different yoga breathing techniques. It could be focused meditation. It could be more of an open monitoring type meditation. So different strategies to really focus and concentrate the mind to help regulate thoughts, emotions, body tension. So there's different techniques that we can do to not only have the person aware of their body tension, but then can they actually reduce the body tension? And then we get to the movement. So this is what you were really asking, is how do we help people move and recover movement again when there's so much fear and tension? But like I said, it starts with those sort of prerequisites, and then you lead up to, let's say you choose a movement that's a little challenging, or a particular movement that you know causes pain, but at the same time you still feel safe. So you can kind of choose that function, that movement, or whatever it is, and then apply these principles. And a lot of these principles come from Neil Pearson's pain care yoga practice, but these recovery of movement guidelines. So you choose this area, and you choose this movement or this function, and you make sure the person feels safe just by simply asking the question, or having that person ask that question to themselves. Okay, do I feel safe? Am I going to be okay? And then you do the three things, which number one is keep your breath calm. Easier said than done, but that's why you have to practice that, right? So regulate the breath, keep it calm, keep the body tension low and easeful as best as you can. Again, way easier said than done, but that's why you have to practice, you know, over time with that. And then the third one is monitoring the pain. So you don't ignore the pain, but you don't pay too much attention to it. And then you want to monitor and watch the thoughts and emotions as well, right? So that's kind of a general guideline. So there's some strategies. You know, of course, there's so much more to it than that, but that's about as simple as I can get just in this time period.
Yeah, I love it. I like it. I really liked what you were talking about initially about that initial awareness and regulation and the importance of that. And, you know, when I think of the autonomic nervous system, you know, we think of the sympathetic versus the parasympathetic. And I think many people with persistent pain are in this kind of sympathetic overdrive. And I think that if we can help them shift into a more parasympathetic state first, before we start adding a lot of more challenging things to them, there can be so much more success. And I think sometimes I've seen when people will make mistakes with interventions, it often is from skipping the beginning, that foundation, and jumping ahead, and then they're disappointed when what they're doing isn't working. Do you see that in your practice also?
Absolutely, absolutely. And what we are talking about here is right in line with pain science, what the science is saying about pain, right? Particularly about persistent pain. We need to calm the nervous system. So if the person feels that movement is a particular threat, even not consciously, right? So this isn't necessarily conscious, just the system, the person's system feels that movement's going to be a threat. We're not going to have the outcome, of easeful movement. The outcome's going to be protection. So the whole human is going to produce protection mechanisms, which may be pain, it may be weakness, spasm, the breath may change, maybe more fear and more anxiety feelings. So it's that, that trying to help the person become in this calmer state, or at least some kind of safety. That's part of, we know that, the DIMS and the SIMS, if anyone's familiar with Butler, Mosley's work. So we want the safety in me feeling, and we can do that. There's so many different ways we can do that, through not just through breathing and mindfulness, but like you had said earlier, the language. our tone of voice, the environment, the lights. You know, there's so much to that. And also the second part of that question you had kind of asked, I think there's something about the pain education in there. Is that the second part? Yeah. You know, and that, yeah. And there's, I mean, that again, it depends on how the person learns. Mm-hmm. Some people may learn in a way where they do like some resources and talking, but you know, a lot of people learn through experience, through kinesthetic learning. So giving the person, so pain education can look like giving the person an actual experience that shows that they can change their pain. Mm-hmm. So, or that shows them that when they do this sort of challenging movement, they are now aware that, wow, my breath, I hold it in this weird way and I kind of do this, I'm kind of tense. And then when we do this other experience, I do this certain breath practice and this certain movement that helps to release the tension, you know, or I shift my weight a different way, or I do this mantra or whatever, all of a sudden, oh, my pain changed. Maybe it went away, or maybe it just changed. That gives them experience that, oh, I can actually influence my pain, which is, that's again, that's pain education. That's pain science education. So I learned that, you know, early on in my career, especially working with Neil Pearson, that it's so valuable to give people an experience that's in line with the pain science instead of always just necessarily chatting about it. I mean, that's important too. Like I said, there's a time and a place to give verbal sort of knowledge and information, but everyone's different.
Yeah, but in a lot of ways, you know, giving people that experience is for them creating that new neurotag. You know, this neurotag mm-hmm. that isn't associated with danger, that is a comfortable, you know, way for them to move. I think that the brain is incredible. And when we can give people different strategies that their brain can perceive is beneficial, is optimal, then they will end up taking that and integrating it into their movement, into other movements, into their life.
Mm-hmm.
So that's great. That's great. Well, I don't want to take up too much of your time, but thank you so much for chatting with me a little bit today. I know people have loved listening. I'm going to include some links below our video here so people can learn more about what you're doing and see some of the video content that you have online. Is there anything else that you think would be interesting for our listeners to hear?
You know, one thing I do want to mention is just the compassion. That's my heart right now, and my mind and my studies are so much into self-compassion and compassionate care. And you had mentioned it earlier about how important it is for the healthcare practitioner as well. You had touched on that. So I just want to leave with that and say, you know, it's sort of a buzzword these days, but, you know, if you're interested, look into, you know, what self-compassion, self-care means for you, both as a person that may be living with or suffering from pain, and also as a healthcare provider, or just a person, a human being on this planet, what self-compassion and self-care means to you. And if you can actually link that blog, Jessica, that I have, Self-Care, the Dark Side, it's a short and sweet blog, but there's some cool information in there.
Yes, will you just email me the link? And if
I will.
I'd be happy to put it below. That's awesome. Awesome.
Okay.
Well, thank you so much. This has just been fantastic. I feel nice and warm. I love you have just a really great warmth about you that is wonderful. So thank you for your time. And for everyone listening, thank you for joining us today for this wonderful chat. And please stay tuned for additional interviews and information coming in the future. Thank you. Have a nice afternoon.